Hi, and welcome to Healthcare IT Today. This is Colin Hung, and today I am joined by Stephen Sinclair, Chief Financial Officer at Graves Gilbert Clinic, located in Bowling Green, Kentucky. Stephen, welcome to the program, and thank you so much for your time.
Thank you, Colin. Pleasure to be with you today.
Now, Stephen, I am excited to talk to you because in the recent MGMA report, which is entitled Performance and Practices of Successful Medical Groups, your organization is one of the only ones that checked all the boxes, and you're doing well in all these different areas, operations, profitability, productivity, and value. Can you maybe share with us some of the things that you're doing to be one of the best performers?
Sure, Colin. With our organization, it starts with the physicians, the providers. And over the years, we've been very fortunate to recruit some very good talent to a community that's been recognized as one of the top 100 places to live in the United States, meaning Bowling Green. Over the past several years, we have expanded our reach into the surrounding communities in South Central Kentucky. And these physicians have been very hard workers. They've been very productive. One of the things that help them, they are driven with their own desire to be productive. But there's things that an organization can do to help them to get there. And one of the things that has helped us is we've been with Allscripts as our EHR provider since 2005. And during that time, we have been able to perfect how the physician can utilize the EHR to maximum efficiency. We have some very talented people that are involved with the templates that are used and how the EHR is set up, which no matter what EHR you have, if you take it out of the box, there's many things that need to be done to maximize the efficiency in the customization of how the program works. So we have people that have had now 15 years of experience with the system and do an excellent job of customizing the system to help the doctors and the mid-level providers to do the best that they can in efficiently treating patients. And that's crucial. If you have providers that are hampered by the systems that they have to use, their efficiency can't be as good. Another thing that we've done is many years ago, we saw the need to have professional coders, and that we converted the emphasis of the physicians away from trying to figure out what to bill for to merely determining the documentation and trying to maximize documentation and doing that well. We can't stop that. We can't replace that. They still have to document, but they don't have to worry about picking codes, whether it's CPT codes, diagnosis codes. So while there's a cost to having professional coders who basically bill everything that is done by our providers, the benefits have been enormous in helping on the productivity side. We have partnered with a company that utilizes some offshore personnel for coding and billing, in fact, and that has worked extremely well for us in helping to control that cost.
So it sounds like you've really invested in putting the technology and the people in place to really take the burden, as much administrative burden off your docs as you can. That's pretty awesome.
Well, yes, Colin, that's exactly right. Being a physician-owned group, the physicians that we have, or several physicians have come here with the idea that they did want to be involved in the management of the company through our board of directors or committees. And that's great. And that's very helpful to have their input in how our organization should be run. But for them to have to be burdened with administrative details in the billing area or even the coding area, just causes a physician to have to spend part of their day deciding those type of things that can best be spent taking care of patients. And that's the conscious decision we made several years ago, and have created that culture that allows those physicians that want to be hard workers to really capitalize on the structure we have. And I think that's very important. The culture that you create in allowing for productivity is crucial.
So maybe you can share with us, what's the impact been on your team of all these improvements or all of these investments? Like, how do they feel about it? Are they extremely happy, or are they, do they go home at 5 o'clock? Like, what's it like for them being in this kind of organization?
Well, that's a really good question. Kind of hard to ask because you're going to get a different spectrum of answers. But I think if you look at a bell-shaped curve, most of our physicians would feel like that they have a good environment within which to work. And that is reflective in the efforts that they put out, many of which work very long hours. They work very, very hard. And that's why our productivity numbers were very, very good in the MGMA survey. Is they are just natured that way. They want to work. They like to work. It's a big part of who they are. They enjoy taking care of patients. And us having the right type of environment for them to be productive allows them to maximize the enjoyment they get out of providing patient care. So many of them just truly enjoy working hard. So I know a lot of people would scratch their head and say, wow, where do you find those doctors? Well, they're out there, and there's a lot of them here in the country, but we've been blessed to have many of those. And one of the things too is that we have to recognize in our environment is that we have a large percentage of Medicaid and Medicare in comparison to MGMA survey data. Well, obviously, reimbursement for those two payers is less than the commercial, and so you have to do something to overcome that disadvantage. We feel a need to care for the people that need the medical attention, and that includes the Medicaid, that includes the Medicare, and you can't just pick and choose. And it's just the reality of our demographics. And our physicians have worked very hard to overcome the low reimbursement that you're going to get from the Medicare and Medicaid patients.
And again, that's just incredible. And how do you keep your team motivated? I mean, I'm sure this, the changes that you had to implement, the processes that you've had to implement, those were all sort of changes to the way they were doing things. How did you keep your team motivated through all of these changes and improvements that you've made over the years to your organization?
Well, the doctors have to feel like the people they have that are running their organization for them, whether it's my position as chief financial officer, the CEO, other people that are there to support them, they have to feel like we are there for their best interest and that we are giving everything that we can to make things work well, and to realize all of the revenue that we should from the encounters that occur, the work that they do, and to minimize the expense that goes along with it. And that's what the MGMA survey does so well in trying to capture how well we're doing that. And we were so excited that we were recognized for being able to do that. But it goes back many, many years where we began a journey trying to implement best practices in various areas that would translate to increased dollars on the bottom line. There's several things that we have done that have enhanced the revenue cycle, and that is, I think, key. And when the doctors see through survey data, when they hear about that, and that recognizes us for doing a good job. And we have auditors that come in and they check our coding and they check our. We have actually a great relationship with a company that assists us on the revenue cycle management, and we get a quarterly report there, and that has been incredibly helpful in identifying very detailed aspects of the revenue cycle process. And when they see people giving feedback as to us implementing best practices in every area that we can effectively do that, is that helps them to have confidence in what we're doing. There's less friction between us and the administrative wing and the provider side because they believe in us. And I think that's important. I think other people that are in positions like I have need to work to gain the confidence of the providers that you're there truly trying to do everything you can to help them be rewarded maximally for the effort they're giving. And our doctors, as we said earlier, are working very, very hard, and it behooves us to do everything we can to get those dollars back to them, to reward them.
I'm going to assume as well, when the doctors are in this kind of culture where they feel supported and they feel like they have a say in how things are being run, and you've put a focus on productivity, I'm assuming that this sort of translates into a good patient experience as well, right? Because the doctors are happier, and you're able to do some things up front, I'm assuming, to make sure that the patient knows and is very transparently knows the prices and those kinds of things and coverage, and so it's just is that sort of happening as well? Are the patients feeling the difference?
Yes, we feel like that our patients really have a great connection relationship with our doctors. Is that when the doctor's in the office, for the most part, all they have to think about is patient care. They don't have to worry about the business aspects. We try to insulate them from that as much as possible, and that does carry over to the patients. They feel that the physician is not distracted in their care that they receive, and so the physician doesn't have to be concerned. Well, what's going on in administration? What's happening with my business? Things aren't going well. And those little subtle problems that are in the background can create a situation where physicians then feel pressured to do even more than they realistically can to overcome problems that maybe we're helping to foster or create. So our goal is to minimize those and to maximize our efficiency and for the benefit really of the patient. One of my beliefs is that when the patient comes here, yes, they're to receive great medical care, and that's obviously number one. But at the same time, the patient has entrusted us with caring for their medical billing, the coding, how their account is handled. And if we do that well, then there's very few situations where they have to get involved or they are stressed. Maybe they have a health problem that's giving them a lot of issues, and then you put on top of it, there's a problem with their account. We don't want that to happen. So our goal is to have a minimum number of accounts that have issues. And so then we are mimicking the great care our doctors are doing by giving great service to our patients on their accounts.
That is just incredible. And so I have to ask, what's sort of the next area of improvement that you're going to tackle? What's sort of on your radar in terms of a place where you can do better?
Well, we are working with the company that works with us on the revenue cycle management process, and they are in a project that will take failed failed clearinghouse edits, okay, when they come back at the clearinghouse level, the 270s, the 270, and we get the 271. They're taking the 271 and they are attempting then to apply corrections to the 270 in order to get that corrected before it even gets to the payer level. And from the initial testing that's been done, it looks like we can, we already have a very low denial rate. Our net denial rate is running about 2%.
Wow.
We're wanting to get it down to about 1%, and we think that this program will do it. The testing indicates that. And so they are working on putting that program in place now as we speak. And I'm so excited about that. So if we can have a net denial rate of about 1%, that's significantly below even best practices. And again, harkens back to our desire to manage the business affairs of our patients in an outstanding way, a great manner.
That's awesome. Really looking. I'm hopefully I can circle back with you and get once you implement it to see what the results are. But
You're right.
that is
Well,
great.
I think it'd be great for a lot of practices. A great tool. Yep.
Well, and let me ask about that if you don't mind me asking. Working with MGMA, what's that been like? Because they of course share a lot of these best practices with your fellow organizations. I mean, have they been a source of information from you? I mean, what's sort of your interaction with MGMA?
Well, that's a great question, Colin, and hard to answer that one very quickly. My affiliation with MGMA goes back 34 years now. Yesterday was my 34th anniversary here with the clinic. And so I've been with MGMA 34 years. And there has been so much I have learned from that fine organization that the information, obviously the magazines, the articles, the survey data that's published, all of that has been invaluable to helping us to understand where we're at with our peers and how we need to improve things. Mm-hmm. The meetings that I've attended over the years have helped me to grow, especially in my early years. My background, I'm a CPA, I was in public accounting, and then came into healthcare and was a newbie, was a rookie, had very little experience, knowledge of healthcare. And so MGMA was invaluable in giving me the tools and the knowledge to help begin the journey of learning more about how this industry works, this business works. And one of the things that actually I miss is there was these section meetings that used to occur. And we obviously being in the South, I would generally attend the Southern section meetings. And in 2005, I met a gentleman that was a vendor that kind of that led us to the person that is helping us on the revenue cycle now. 15, well, as it turned out, 12 years later. And so those things that happen over a period of years, it leads to great things many years later often. And that's one that has been a shining example of something that I was looking for and found it at that meeting. It was in Savannah in 2005. And then that helped us immensely, but it led to another thing that's taken us to another level. And I'm so grateful for those things, because without those meetings, without that interaction with other people that's in leadership positions, without interaction with other vendors, I would have missed out on so much learning. It's one of the things that I missed this year with the COVID situation and not having the meetings. The virtual meetings, are helpful, but there's nothing that replaces where you're sitting there and you're talking with a colleague that's in another part of the country, or maybe the same part of the country you're in, and you're talking about issues and how are you addressing this and how are you addressing that. And it's just an invaluable experience that I can't wait for us to get back to.
I totally agree with you there. There is something to be said about the special nature of being able to just strike up a conversation with somebody that
Right.
you're in a session with or sitting down at lunch with, which you cannot replicate online. It's very difficult.
Correct. Yeah.
Well, thank you for that answer. That's very informative. And let me ask this final question. Stephen, what advice would you give to a fellow CFO who is at another organization who just doesn't really know where to start on the journey to becoming a better performer or best performer like you are? What advice would you give them?
Uh, I don't mean this to sound bad. Call me. I'd be glad to help you because I can tell you how to avoid the mistakes that I made. I've made many mistakes, and so that I can shorten your window for learning because I've lived that learning experience. But also uh, look at the very details of how everything works and find the pinch points that create problems in it and tackle those until they're fixed.
Mm,
Don't accept no for an answer. Don't accept we've always done it this way before. Don't accept we can't change that. That's just how it is. Don't accept that. Go for excellence. Uh, go for have as your goal perfection, knowing you won't achieve it, but that you're going to get as close as you can. And and so don't be afraid to spend the time to dig into the details of how departments work, individual jobs work, individual processes. And you'll probably find where there's areas that really need to be addressed and they just have been overlooked, but will, in a cumulative way, make a big positive impact for your organization if you deal with them.
that's amazing. Thank you. And now you're probably going to get a flood of phone calls and emails because of that offer that you just made.
Well, there's been many people over the years that have helped me, and I'm immensely grateful for that. And I want to do the same thing for others. I want to help.
Well, that's I think you are an epitome of the culture that you are trying that you have implemented there at your organization, just being so helpful and doing everything for others. It is amazing to hear and see.
It comes back to you.
I love it. Well, Stephen, thank you so much for your time today. I really appreciate everything you've shared. I think our audience is going to love all the different pieces of advice that you've given. So do appreciate your time and thank you so much.
You're welcome, Colin. Thank you.
This is Colin Hung at Healthcare IT Today. Thanks for listening and have a great week.